Hi, I'm Dr. Gina Pritchard, here with my good friend and colleague, Dr. Victor Avis. And today we want to talk to you about oral health and total wellness or total body health. So Dr. Avis, we have an exciting webinar as well as a live meeting coming up. So tell us about all of this buzz about the trend of collaboration cures or dentists, medicine, nurse practitioners, medical doctors working together with dental teams to save a life. Would you please elaborate on this and tell everyone why they don't want to miss this webinar?
Well, thanks, Dr. Pritchard. I'm so proud to have developed this collaborative practice. We're now in the beginning of our third year, and it's been very exciting. And it's exciting because my role as a dentist has really evolved from, in the beginning of my career, hoping to help people save their teeth, to now really wanting to be a person that helps to save people's lives. Mm-hmm. And my relationship with you professionally and with Dr. Bale and Dr. Doneen has just educated me to the role that dentistry, the important role that dentistry plays in diagnosing cardiovascular disease and then being part of the treatment to eliminate. And I think it would be helpful if people understood in a snapshot what causes heart attacks and strokes.
Very, very good point. Let me elaborate on that for just a minute. So we all know in the Bale-Doneen method community, or this community of healthcare providers, both dentists, medical doctors, nurse practitioners, the whole group of what we call arteriologists, right? We're focusing on health of the arterial system, health of the blood vessels. Nonetheless, all of us know that the powerful prevention method involves, first of all, understanding what an individual's arteries look like, which we have the tools, the technology available to easily do that today. And after we understand where you stand in terms of your cardiovascular risk based on disease or health of the arteries, then we need to understand, do you have inflammation and what are your root causes of inflammation? It's well known in the layperson's literature. You see it on the newspapers and the magazines almost every month that inflammation is the driver of all chronic disease, but none more true than cardiovascular disease. So we test for inflammation, and then the real detective work begins, or the real life-saving work begins, when we start to uncover those root causes of inflammation and the root causes of disease in an individual's life. So just a snapshot of a few of those root causes: blood pressure issues, for one, which obviously is screened for in the dentist office as well as evaluated in other healthcare providers' offices as well. Blood sugar issues, which is starting to take place also in the dental offices, but certainly dentists and medical teams are working together to diagnose blood sugar issues much earlier than has been diagnosed historically in the past. The other issues, several of them revolve around dental-related problems. So oral health on many levels, airway health. You can elaborate on that, obviously far greater than I can, but the reason that dental teams and medical teams have come together and must come together and collaborate, we say collaboration cures, is because the root causes cannot be fully and effectively treated without the life-saving work of an arteriologist or an arteriology specialist that's in the dentistry field, such as you.
Thanks, Gina. And so from my perspective, when you consider that they estimate that 75% of the American population has periodontal disease. I don't know what the percentage of people are going around with root canal teeth that either have chronic infection or infection that's acute. And then the numbers of people with sleep apnea are significant, and we expect over 40% of the population snores. And all of these things combined together are under the realm of the dental office. And so if you have a dental team that understands this and understands how it could be causative of heart attack and stroke, the potential to save lives is significant. One of my goals is that all of my patients have a CIMT, which is an ultrasound to determine if they have disease. And if they have disease, to at least expose them to Dr. Pritchard and the Bale-Donine method to get a proper assessment. In this way, we could knock heart attack and stroke off from being the number 1 and 3 lethal diseases in America. Early detection and prevention is the key. So we'd love you to, if you're in New York, to come to our seminar live. If you're somewhere else in the country, tune in via webinar. And the date of the evening is
February the 28th at 7 p.m. Eastern time.
Great.
Right.
So go ahead, Gina. Thank you so much.
Oh, thank you. And just click the link below. You want to sign up if you're not in the New York area, but if you're in the New York area, there are a limited number of seats where you can attend this event live, and it's one you don't want to miss. Thank you.
Thanks. Bye-bye.
Bye-bye.